please verify your first name and date of birth?
James. In 1984.
Well, welcome to my office, James. When was your last checkup?
A couple of years ago.
Any abnormal findings?
Back then, no.
And how are you feeling overall?
My head hurts a bit. I think I might have a concussion.
How do you think you might have gotten that?
A couple of days ago, I was jumping on the bed.
Okay.
And I just fell, hit my head on the headrest.
Can you point to where you hurt your head?
The back, right there.
Okay. I'm not feeling any obvious indentations of the head.
Yeah, right there.
Did you lose consciousness?
No, just hurt.
On a scale of 1 to 10, how intense was your pain?
I would say 6. Then I took some painkillers and it went down, but ever since then, it's been a little hurting.
Okay, so pain was responsive to medication. Any other symptoms like blurred vision, double vision, or hearing loss?
I think hearing loss. I've been hearing a bit less on my right ear.
Did that start right after the injury to the head?
No, that was before.
Okay,
I
and
was to a concert and it was a bit loud. And afterward I felt like I have less hearing on this side.
and when was that?
2 weeks ago.
Any pain associated with that or just the hearing loss?
No, just I don't hear as well when I put music on, for example.
So no pain. Are you allergic to anything, James?
Coconuts.
Coconuts. And how did you find that out?
I was in Hawaii and I had coconut pudding and my whole body became swollen and red.
Okay, were you hospitalized for that?
No, but I had to go to the emergency and they gave me some medicine.
Did they use an EpiPen on you?
Yes.
So that must have been a severe allergic reaction.
And they told me to keep one around.
Are you taking any medication on a daily basis?
Vitamins.
Were you told that you were deficient in any vitamins?
Yeah, I was told I'm a little on the low side for vitamin D and vitamin B12.
Okay. Did you hurt anywhere else in your body when you had the head injury, or just the head was affected?
Just the head was affected from the head injury, but I've also had some stomach pains. I don't think they're related because it started before.
Okay.
Yeah, just, I don't know, little pain, aching sometimes.
And you showed me in the middle of the stomach. How about the side?
Yeah, usually actually it's here.
Okay, so here.
Yeah.
Okay. Have you had any changes in your diet recently?
No.
And how's your appetite? Have you noticed any weight loss, weight gain?
No.
Any history of hypo or hypotension?
Some hypertension.
Okay. Sounds good. So let's go ahead and begin the annual checkup. I'm going to put on your gloves. Are you experiencing pain right now when you're in your body?
Very faint in my head. That's it.
The back of your head. So I'm gonna first take your vital signs, and I'll start by taking your temperature. Have you experienced any flu-like symptoms in the last 2 weeks?
No, but a little. My nose has been running a little bit.
Runny nose. Just make a note of that. Do you suffer from any seasonal allergies?
Yeah.
Okay. So that could explain, unless anything else comes out positive in today's exam. Okay. Is it okay if I slide this over your forehead? 98.5. So you do not have a fever. Let's check your oxygenation and heart rate. This is going to go over your index, and you can just rest there. I'm going to check your pulse. That's normal. I'm also going to take your pulse radially. Good. Hand over your brachial. Very well. Okay, pulse is 95 beats per minute, so that's within normal parameters. And 99.5 oxygenation, so I'm not concerned about the rate at which your blood is oxygenated. Normal temperature, oxygenation, pulse, not hyperdynamic. Good. Negative. Good. I'm gonna go ahead and check your blood pressure. You said you were a little hypertensive. Do you remember what your blood pressure is usually?
Usually 130/80.
130/80. Okay, that's a little bit elevated. So let's go ahead and check it out today. And is it okay if I
Yes.
do this over your right arm? You can just relax your arm. There, just like that. Then I'm gonna slide this right here. Over here. Good. Does this run in your family?
Mm-hmm.
Okay, so one of your parents or both of them are hypertensive?
My dad.
Okay. So blood pressure is a little elevated, just like you said. I was able to read 130/75. is your level of sodium intake during the day?
Probably a little high. I do like salty things. I eat a lot of chips.
Okay, and are you on any medication for this? So we should consider putting you on a beta blocker to bring the high blood pressure a little bit under control. Would you be open to that?
I think so, as long as I understand any side effects, and I'm worried about those.
Okay, yeah, so the side effects should be minimal. I'm thinking about lisinopril, which is a very tested medication that has been existed for decades with minimal side effects. So we can explore that. I'm also going to listen to your heart and your lungs. Have you had any heart palpitations?
No.
Any coughing?
No. Nothing out of the ordinary.
Just go ahead and breathe normally. I'm listening for any murmurs, any skipped beats or abnormalities of the heart. And I'm able to hear all sounds clearly, no extra sounds. Good. Also going to use the bell side. And let's check the lungs. Go ahead and take a deep breath in and out. And you can just breathe normally now. Good. Not hearing any adventitious sounds. No bruit, no hissing or wheezing. Good. So whatever is going on with your runny nose is just an upper respiratory. I'm not hearing any signs of pneumonia or anything concerning with your lungs.
That's good.
Okay. I'm going to go ahead and palpate your head and feel for any lumps, bumps, any indentations, especially in the back of the head where you had the fall.
Okay.
Go ahead and just relax. I'm checking for ovular symmetry. And applying a slight pressure. Any pain here in the back?
A little bit.
Okay, good. So I'm not feeling any major indentations or lumps or bumps of the head, which is a good sign. On a scale of 1 to 10, how intense was the pain when I was pressing down on the back of the head there?
Maybe a 2.
2 out of 10. So that's not too bad. Okay. Good. Let's go ahead and check your eyes. Go ahead and look at my nose. I'm going to check for the pupil dilation and contraction. Okay. So try not to move the head. Don't look in the light right here. Good. Now, look into the distance for me. Try not to move your head again. So pupils are round and reactive to light. I see that they have the normal size and shape in normal light conditions. I want you to try to look at my nose and keep your head steady and try to touch the light over here with either your right or your left hand. Perfect. And now again, touch it right here. Good. Right here. Good. Good. Perfect. So I see you have a normal level of coordination between your hands and your eyes. Close one eye for me. Good. And look at my nose and try to count how many fingers I'm holding up.
2.
Good. Don't look at the fingers, just the nose.
1.
Good.
2.
Good.
1. 5.
Good. So peripheral vision is normal. Not concerned about your eye mobility, normal pupils. I'm going to go ahead and look at your ears. First, I'm going to start by palpating them. Is that okay?
Mm-hmm.
Going to check behind the ear, the mastoid bone process. Any pain there?
Mm-mm.
Good. I'm going to pull down on them. Any pain here?
No.
Okay, I'm pulling up. Any pain there?
No.
Back. Any pain?
No.
Very well. Okay. I'm going to take a couple of measurements of your limbs and check for the overall proportions of your body. Can you please elevate your arms just like this, parallel to the ground for me? 72 and a half. Yes, good, right there. 71 and 8. Okay, you can lower your hands now and arms. I'm going to check the circumference of the head as well. Okay, 22 and a half. Good. Okay, perfect. Let's go ahead and just relax your arm, palm up. I'm going to tap right here. Good. And just relax the arm, no tension. Good. Good. Any joint pain?
No.
No joint. Good. I'm going to take this arm, so I want you to give me all the weight. Let's try again. Good. And again. Just give me all the weight. Perfect. And let's check your knees as well. Just relax your leg. Good. Good. So I'm gonna use my otoscopy here to take a peek inside your ears. Have you had any ear infections in the last 6 months?
No, but every once in a while I need an ear cleaning.
Okay.
This wax buildup that happens.
How often do you need that done?
Maybe once a year or once every 2 years.
Is it wet wax or dry wax?
Usually dry.
And are the cleanings usually painful for you?
No.
Okay. Made a note of that. So go ahead and look towards your left. So I'm seeing a little bit of a discharge. Conal light is present. All the bony landmarks are present. Tympanic is pearl gray. Well-defined margins. Just a little bit of wax buildup. When was your last cleaning?
About a year ago.
Okay, so not much buildup there. A little bit of redness and wet wax. Good. Okay, let's go ahead and check the other one. Okay, I'm able to visualize tympanic membrane. Also seeing the bony landmarks. Pearl gray colors. No redness. No infection. And slightly more wax buildup. You definitely need to schedule a cleaning for this here. Okay. So that's very interesting. You have a little more wax built up in your left ear than your right. But you mentioned that the hearing loss happens on your right ear, right?
Yeah, that's right.
So that means that the wax buildup is not really contributing to your loss of hearing, because it should be more so on this one then.
Yeah, that's not good.
Let's go ahead and do a couple of hearing tests. So keep your eyes closed. And I'm going to create a vibration and place it by your ear. This is position 1, position 2. Which one was louder?
Position 2.
Good. And we're going to do the same on your right ear. Position 1, position 2.
Position 1.
Let's try that again. Position 1, position 2.
Position 1.
Position 1. Okay. So your right ear needs a auditory assessment, as you do seem to have some hearing loss that needs to be quantified, and we may even consider a hearing aid if we can't reverse what's happening.
Okay. Should I be worried?
No, we'll take it one step at a time.
Okay, doctor.
Okay. I'm also going to check your optic nerve and optic disc. So you mentioned no vision loss, no blurred vision, nothing abnormal right after the fall. Okay. And how long have you had the glasses for?
Most of my life.
And
Since I was in 5th grade.
And your last eye exam was?
Last year.
Last year, good. Okay, can you remove the glasses for me? Okay, go ahead and look into the distance. Gonna just take a peek at the base of the eye. Conjunctiva is pink and moist. Sclera is white. Gonna look at the optic disc. Good. Pink and moist. White sclera, and look up, look down, left and right. Good. Okay, so optic nerve and optic disc were intact. You can put your glasses back on.
Thank you.
Going to make a note of that. I did not see any retinal concerns. Cornea was intact and optic nerve had a good ratio. Good. Next up, I'm going to give you something to smell. Have you noticed any changes with your smell?
Mm-mm.
Okay, so you're able to smell just fine usually.
Yeah.
Okay, so I'm going to give you an essence.
Vanilla.
Good. And I'm going to give you a second smell. It's a little more faint than the first one. Can you close one of the nostrils for me? Okay.
Avocado.
Okay. Very good. That's a very hard one to detect. And I'm also going to give you something to taste. Go ahead and stick out your tongue for me. What does that taste like?
Coffee.
Good. So let's go ahead and take a sample of the inside of your nose. That's one. And good, two. So I'm going to send this to the lab and we'll test for any common viral or bacterial infections for you.
Okay.
Let's go ahead and check the back of your throat. Can you open your mouth for me? Say ah. Okay, good teeth, no inflammation, and stick out your tongue and move your tongue up and down. Good, perfect. Can you squeeze my arms, my hand? Yeah, hard. Good, perfect. And can you shrug up for me? I'm checking your cranial nerves now. Shrug up. Good, and down. Good. Puff out your cheeks. Good, keep them puffed. Don't let me unpuff them. Good. Okay. Can you push your tongue into your cheek? And the other one. Good. I'm going to attempt to push you back. Don't let me do that. Resist. Good. And I'm going to attempt to pull you forward. Don't let me do that. Good. Again, I'm going to attempt to push you back. Don't let me do that. Any pain in the lower back there?
No.
Good. And spread out your fingers. Just go ahead and check your palms. I'm looking for any palmar erythema, any redness. Okay, you can just keep it up like this for me. Yes. Good. And they are symmetric. You can lower this one now. I'm going to check your nails, looking for any clubbing or pitting of the nails. Good. And capillary refills within 2 seconds. Good. 2 seconds, and temperature is about the same. Do you usually get sweaty hands or cold hands? Good. I'm looking at the skin. How long have you had the scar for?
A long time. I got it when I was 3. I was jumping on the bed.
Okay. I'm just checking on whether the blood flow works over it, and checking a skin reaction to the light touch. Yeah, it looks like it healed just right. Good. Do you have any pain there?
Mm-mm.
So keep your eyes closed, and I'm going to touch you either on the left side or the right side of your body. Go ahead and say left or right.
Left.
Good.
Right. Right. Left. Right. Left.
Now I'm going to create a continuous touch, and I want you to tell me when you stop feeling it.
Now. 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 Now.
Good. Next up, I'm going to continue checking your dermatomes, and I have here, may I have your palm? I have here a sharp object and then a soft one. Go ahead and close your eyes and say if you feel sharp or dull.
Dull.
Okay, good.
Sharp.
Good.
Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp.
Good. Now one of them is going to be wet and the other one is going to be cold. So go ahead and keep your eyes closed and say wet or cold.
Wet. Cold. Wet. Cold. Wet. Wet. Cold. Cold. Wet. Wet. I think cold.
Good.
Wet.
Good. So I have here two slightly sharp objects and I'm going to touch either with one of them or both of them. So I want you to say one or two.
Okay.
Keep your eyes closed.
One. Two. One. Two.
Good.
Two.
Good.
Two. Two. One. Two. Two. One. One. Two. One. Two. One. Two.
Good. I'm also going to check your lymph nodes, palpate them and see if I can detect any inflammations of the lymph nodes. Checking your preauricular lymph nodes first in front of the ear. And posterior auricular. And occipital in the back of the head. Cervical on your neck. And deep cervical towards the spine. counselor. And submandibular and submental. And I'm going to gently tap on your sinuses, starting with the frontal sinus and the maxillar. And open your mouth slightly. Any pain in the jawline? Good. Alright, go ahead and lay down. I'm going to take a look at your abdomen, your back, legs and feet.
Okay.
Okay, James, are you comfortable?
Yes.
Okay, let's go ahead and put the arms next to our body. And I'm going to just take a listen at your tummy. And I'm listening for the internal abdominal activity, which should be heard in all 4 quadrants. Good. Did you have breakfast this morning?
Not yet.
Not yet. I'm hearing a minimal level of activity. And no swooshing sounds. Sounds like everything is normal. Good. Going to do some percussion. A little bit of difference here in the resonance. Sounds like we have a little more fluid on the left side. But the difference is not out of the normal. Okay. I'm going to go ahead and do a light palpation, check for any masses and get a sense of the size of your organs here. Assessing the liver first. The tip of the liver there, not enlarged. The spleen underneath your left rib cage, normal size. And pressing down on your kidneys. Any pain there? That's good. So going to listen to your aortic pulse. That's normal. And check for the apex pulse, where I can actually feel the point of maximum impulse in between the fifth intercostal space, right there. 2, 3, 4, 5, 6. That's quite normal. Good. Okay, let's go ahead and take a look at your back. So, abdominal assessment was a pass. Healthy level of internal abdominal cavity activity. Aortic pulse was normal. PMI normal. I'm gonna go ahead and take a look at your back, and I'll start by doing a visual inspection first. And I'm looking for any abnormal colors, any obvious lesions, injuries. Any obvious curvatures of the spine. Skin looks healthy. I'm seeing a couple of moles. Red and brown. When is the last time you've had a dermatological assessment done? Many years ago. Okay, I do recommend you go see a dermatologist to just keep an eye on the moles. I'm also going to see if there are any indentations of the skin or any pulses of the muscles here. No muscle twitches, no pulsations. Skin is reacting normally. Going to palpate your spine next. Starting with the cervical spine, C1 through C5. Just straight. Going down to L1 and 12 thoracic. And checking the vertebrae. Spine is straight. No obvious curvatures are noted. I'm going to percuss the back next. Resonance sounds are symmetric. And tapping of the spine did not reveal any neurological reaction, which is normal. Okay, I'm gonna go ahead and listen to your nose. Go ahead and just breathe normally. Can you say very softly 99?
99.
Again.
99. 99.
Good. So I was not able to hear 99 to my stethoscope, which is normal. And let's quickly check the dermatomes in your back as well, which are areas of the skin that are innervated by the same spinal nerve.
Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. 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 Dull.
And now I'm going to place something cold on your right side or left side of the spine. Go ahead and say left or right.
Right. Left. Left. Right. Left. Both.
Good. Okay, James, you can put your shirt back on now. Okay, James, is it okay if I remove the socks?
Yes.
Going to begin by doing a visual inspection of your knees, legs, and feet. Checking for psoriasis, skin abnormalities, dermatitis, visual signs of edema. No nail clubbing or pitting present. skin issues detected. I'm going to palpate your legs. Checking for edema, pain, over your metatarsal bones. Even temperature, not detecting any gradient, and no excess sweating. Go ahead and push into my arms with the pads of your legs. Good, perfect. And now try to bring your toes towards your head. Good. Going to check your popliteal pulse. That's normal. And the pedal pulse. 2+ synchronized. Good. Go ahead and bend your leg. Like that, yes. Good. And over your right arm as well, bend it slightly and bring it outwards. Perfect. Good. I'm going to do the Babinski test. Good. Good. Perfect. And can you tell me if I'm touching you on your left foot or your right one?
Left.
Good.
Right. Right. Left. Left. Right. Right. Left.
Good. So no nerve damage detected. Right. Go ahead and stand up and let's discuss the results. And I'll place your socks back on. Okay, James, this concludes the assessment for today. I did a thorough investigation. I wasn't able to find anything abnormal with you. I took a sample of the inside of your nose and we can see if you're dealing with an infection and if we need to treat you with any antibiotics or not. The back seems okay. I assume it's just maybe a muscle sprain from your abdomen towards your back. Maybe that's why you're experiencing the pain, so I wouldn't be too concerned. Everything else checks out: ears, eyes, nose, abdomen, legs and feet, so no abnormal findings. And I also did a neurological assessment because of your head injury there, and it all looks okay. Do you have any questions for me today?
No.
Okay, good. Thank you for coming in, and I hope to see you soon, but not very soon.
Thank you for seeing me, Dr. Nola.